Hello, InLife Benefits team. My name is Dr. Cecilia Paz Cruz-Ram, but people call me Dr. Z or Dr. Zech. I'm from Dr. Anywhere. I'm the medical director for PH. Well, for many Filipinos, they're usually traditional. They want that, they feel more comfortable in that in-person or person-to-person interaction, that touch therapy. Usually, after a consultation, for example, ABP is not done or some vital signs were not taken, and the doctor just talk to you, the patient will just say, "Oh, nagkwentuhan lang kami ni doctor wala man lang ginawa sa akin," ganun. So, the more mature generation are like that. They want the touch examination, even if it's not needed. Because in reality, 70% of the diagnosis is really taken through history taking. And then, of course, partial PE. It's actually a combination of multiple factors, no? So, pwedeng trust. Some patients would often go to their preferred physician already, especially the more matured ones. Say, I've been seeing Dr. A for the longest time, so I want to see Dr. A. As opposed to the younger generations na they're okay with seeing different doctors for every consultation. So, internet access, yes, maybe it's a bit of a challenge because not all have internet access. Although alam natin sa bahay, regardless of the size, internet is kumbaga parang common staple na yan parang rice. Net is life. And then, of course, trustworthiness. So you're not sure at the onset if you're really talking to a real doctor. Yes, that's actually an understandable concern. As I mentioned earlier, 70% of the diagnosis is taken from history taking. So, kailangan masinop si doktor na magtanong ng mga right questions. Not leading questions, but asking the right questions to get the right symptoms from the patient. And also, we've also released a telemedicine virtual physical examination guidelines. Makikita mo pa lang sa pag-open ng camera, pag hello ni patient, you'll already see signs. It really depends on the chief complaint of the patient. So, similar to when you see a patient face-to-face, actually, pagpasok mo pa lang ng consult room ng doktor, ina-examine ka na ng doktor. So, that's how we usually tell our patients, the members, even the doctors, alam nila na kung halimbawa, kung diretso ka maglakad, yan, or medyo tabingi or patagilid ka maglakad. So, ganun, that's already part of the moment you go inside the room of the doctor. So, it's similar to the moment that you open your camera and see the doctor. The doctor is already looking for signs that may or may not be related to your current condition. Pero usually, since the chief complaint is indicated, yun yung watch out for ni doctor. In some cases, people would think that it's more expensive using because it's an app, no? So mas mataas yung cost sa paggamit ng app. They don't know that you just need an internet. And then, of course, if you're an HMO patient, it's covered by your HMO already. But if you're not an HMO patient, our prices are still relatively reasonable as compared to the others. Plus, you have to take into consideration the time saved from transportation, parking fees, meals, especially if the doctor's appointment, supposedly, the doctor's consultation starts at 10, but you're number 16, so you don't know what time the doctor will be able to see you face-to-face. So, technically, mas makaka-save ka talaga if you're using the Telemed app or Dr. Anywhere app, for that matter. It's a two-edged, no? So, if the patient's experience is good, meaning the consultation was conducted in a very professional manner, the patient was able to get what she or he wants out of the consultation, not just the medical certificate, no, because we don't encourage asking for medical certificate if it is not really necessary. If the doctor was able to explain the diagnosis, the symptoms well, then the patient experience would be good. So the percentage of the patient following up or using the app again would be higher, as opposed to if they were able to encounter a doctor who was not in the mood, dahil tao lang din naman ang doktor natin. But we do get feedback, like if they're happy or not happy, and then those are part of the things that we monitor on a regular basis, because what we want is for the patient experience to be seamless, para they will go back and then realize the advantages of using Doctor Anywhere app. Actually, even during break times, patient can see a doctor. So we have two kinds of consultation. So the appointment one and the on-demand. So the on-demand is for primary care physicians. So for example, masama pakiramdam mo, punta ka lang sa isang gilid. So you have to ensure first, of course, that you're in a private and quiet place para to ensure confidentiality, diba? On the patient side and also on the doctor side. So you can go about your day and then just log in when it's already time for your consultation. So that's how seamless it is and how non-disruptive it is, or how actually aligns or harmonizes with your daily activities. Unfortunately, most physicians would want to practice in the cities. So, as I mentioned earlier, net is life. Since they have access to the internet, the patients would usually just tap on or log on to the app and see a specialist. So that's a very good advantage. Even if, for example, the doctor is practicing in Metro Manila, the patient is somewhere in the Bondocs, basta may internet access sila, they can see a specialist anytime. During the pandemic, when there was a spike in the consultation demand, because no one would like to go to a hospital because of the fear of being exposed to COVID, most of the patients actually access the telemedicine platform, so DA. So DA was the only platform during that time who were able to address the demands in terms of consultations. But until now, we still maintain that balance between demand and the supply of doctors. Well, of course, part of the application is for them to upload or submit their credentials. And we validate these credentials through PRC first, and then, of course, with the different specialties. We request for the Specialist Society to certify that these doctors are diplomates or fellows of their society. So all our specialists are validated or credentialed, even our primary care physicians, of course. We follow data privacy, security. We do regular checks for that. The data of the patient is in the cloud. What's good about Dr. Anywhere in particular, our platform, is regardless of which physician or which specialty you are consulting with at a particular time, the doctor seeing you can see your previous history. So there's continuity of care. So that's what we wanted to show our doctors and the patients, that regardless, there would really be continuity of care. There would be no need to ask questions again and again, because your records are already accessible and are secured via our cloud. After the doctor is able to evaluate that it's a possible emergency or an urgent case, they advise the patient to go to the nearest emergency department, hospital of choice, of course, but they issue a referral. Pwede yun na, halimbawa, nakita kita, say, major gash, not a gash, it's a large wound on your hand, and then it needs stitches. So the doctor will say, okay, you have to go to the nearest hospital and have your wound checked and stitched. So while the patient is in transit, the doctor is already creating a referral. Kasi na history na siya ng doctor eh. So when the patient goes to the emergency department of the hospital, he will just show the referral. So there would still be continuity of care. So that's the guidelines or standard that we've asked our doctors to follow. Of course, for lab tests and even medications, our doctors can issue requests for that. And for specific partners, they actually have a list of by priority kung kanino namin i-refer yung mga members nila. So, kung walang preferred naman na facility, si HMO or si partner, the patient is requesting, say, they want to go to clinic ABC, they would go to that and they would present the request already. So what's good about this is yun nga, after consultation, while you're in transit going to the particular medical facility, you're already doing the consultation, and then the doctor's already creating the request. By the time you reach the medical facility, present mo na lang yung request mo. Per guidelines that we've established, we only cater to acute cases. Cough, colds, fever, like some upper respiratory tract infection, mild to moderate abdominal pain, usually acute cases, and follow-ups also for chronic conditions or lifestyle-related conditions. For example, you've already been diagnosed with hypertension, diabetes. After the baseline, you just did a regular follow-up with your physician. We can also do that. So, telemedicine app or Doctor Anywhere is not meant to replace emergency care, because emergency care is still emergency care. The only thing that the doctor can do is to pacify the patient at the time of consultation, and then ensure proper endorsement to the facility when the patient's already on site or in the medical facility. Of course, yung mga chronic cases, if there's massive bleeding, stroke-like symptoms, consistently high fever, and similar to the situation or uncontrolled BP, severe headache, those are probable signs of emergency conditions. So, yun yung dapat na diretso na sa ospital. So, Doctor Anywhere, we would want to focus just on the acute conditions and chronic conditions that are not emergent in nature. Well, yes, your first doctor can really be done online, provided that it's not an urgent condition. So, simple cough, colds, slight to moderate grade fever, non-emergency symptoms, can see a primary care physician online, like Doctor Anywhere. So it's at the end of it all, it's using the app at the right time, at the right place, and at the right setting.